Hey guys, my name is Katie. I'm going to be your nurse educator for today. I hope you guys have been having good weeks out on the unit, learning a lot from your preceptors, getting to experience a lot of different things, do a lot of different things as brand new nurse residents. I remember when I was a brand new nurse and there was so much going on, so much to learn. So hopefully you guys can learn a little bit from this class. So in our class, we're going to be talking about shock and vasopressor therapy. So how many of you guys have used vasopressors at work already? Okay. How many of you would say that you feel comfortable using vasopressors on your own? Okay. Well, hopefully by the end of this class, you're going to feel a little bit more comfortable, a bit more confident as you go into your units and you take care of those critical patients who really do need vasopressor therapy and are in shock. So, going through this, so your learning objectives, just going through those real quick. You're going to be able to list the different types of inotropic and vasopressor drugs used in critical care areas today. In addition, you should be able to discuss the importance of effective and timely interventions in the presence of shock. Thirdly, to be able to apply the pharmacological elements of vasopressor therapies to the pathophysiological principles of shock and giving accurate treatments and nursing interventions. And then finally, demonstrate the understanding of vasopressor therapy in real patient scenarios by using the nursing process. So, diving right into this, I wanted to show you guys this video real quick. All right. So it's an inspirational video. So just as she said, you know, why do we do what we do? She said she talked about how she believes in the power of science and medicine. And a lot of what we're going to be covering in this class is kind of that nitty-gritty stuff. We're going to be talking about receptors and the molecular parts of the pathophysiology. But we care about these things so much because we care about our patients that it is these accurate and timely interventions under God's sovereignty that save lives. So we do pay attention to the details for that very reason. So, should we be shocked by shock? Well, according to the New England Journal of Medicine, shock is defined as the clinical expression of circulatory failure that results in inadequate cellular oxygen utilization. What does that mean? Well, oxygen can't get to the tissues. Oxygen can't get to the tissues. That causes problems. In fact, 33% or 1/3 of our patients in critical care settings are going to experience some type of shock. And 1 out of 5 of those are going to die from shock. So this is some serious stuff. We really need to sharpen our clinical skills and be advocates for our patients. How do we find shock? Shock is based on clinical, hemodynamic, and biochemical presentations by the patient. And that's how we determine what type of shock and what type of treatment we needed to go about in order to save those organs. So in short, do you like my GIF here? In shock, all types of shock, we end up with low perfusion. So that's a lack of blood flow to the tissues. If there's no blood flow to the tissues, there's no oxygen to the tissues either. And without any oxygen to the tissues, you end up with ischemia. And we know that ischemia, not treated, results in necrosis, which is not reversible. Necrosis then leads to MODS, which is multi-organ dysfunction syndrome. And with multiple organs failing, our patient's mortality increases dramatically. So, with that being said, early recognition of shock is crucial for our patients. All right. So, as you guys were required to do that offloading material, we're going to put your knowledge to the test with some information on shock. We're going to do a Kahoot quiz together. So let's go ahead and go through that.